afternoon.
Good afternoon, dear participants from all over the world. Good afternoon. We are particularly delighted to see you once again with us and to have you with us. I would like to remind you that our webinar is available in 2 languages, English, French, and Spanish. And today we are privileged to have not one, but 3 human rights defenders, Ms. Beatrice Ogutu, Mr. Kudely Sokoine, and Joseph Ogol. I hope I pronounced the names properly, from the NGO called ICS SP Africa with us for today's seminar. They will share with us their successful experience and innovative initiatives from an Africa-based NGO that works in rural areas together with families, communities, and other stakeholders to create a safe and fostering environment for children to reach their full potential. And at the very core of their work, it's skillful parenting and ending violence against children. These are rooted in well-targeted economic empowerment and agribusiness programs that aim to improve household income and food security. In their experience, this combined approach leads better chances for sustainably securing the well-being of children and families. So without further delay, I'm happy to give the floor. Please, Beatrice, you have the floor.
Thank you very much, Mr. Yao, for the introduction. Thank you, BISA team, for inviting us for this webinar to share our experiences from Africa on economic strengthening interventions to address VAC. We are indeed happy to be part of this team. Thank you everyone for joining in this. Indeed, this is a great piece of initiative that we are doing in Africa, and I'm sure through all our initiatives in the different organizations, we have been doing this for quite a number of years. And therefore today we are happy that you're part of this conversation to see how best economic interventions can be able to address VAC outcomes. By way of introduction, Mr. Yao has already introduced us. My name is Beatrice Ogutu. I lead the team at Investing in Children and Their Societies. We are an African-based NGO based in Nairobi, Kenya. And together with me, my colleagues, Mr. Kudely Sokoine and Mr. Joseph Ogol will be co-presenters with me in this particular webinar. Thank you again for joining, and we look forward to fruitful deliberations in the next 2 hours or so. We will be reflecting on a number of issues around economic strengthening to prevent violence against children. And I'd like to request Mr. Yao to be able to share the screen with us so that we can follow the conversations. As Mr. Yao has already said, we will be asking you to reflect together with us and to be able to note down your questions on the chat box, and we will be able to clarify after every other session. So thank you very much, and we look forward to fruitful engagements for the next 2 hours or so. Okay. So the topic of today is part of a series of webinars that the BISA team has been organizing over the last couple of years, the last couple of weeks. And today we are going to reflect on economic strengthening interventions to address violence against children. Part of our agenda for reflection today, we'll be able to give a brief overview of our organization, what we do and why we do it. We'll be able to reflect a bit together with you on the relationship between poverty and violence against children. We will share our experiences around how economic interventions, whether they are combined with other interventions or they are standalone, improve violence against children outcomes. We'll be looking at some of the results and evidence from the work that we do in Kenya, Tanzania, and Cote d'Ivoire. And we will be reflecting together on the lessons on why implementing economic interventions in the context of violence against children remains important. In each of these sessions, we will have moments where we reflect together on the questions you will be able to raise, and we will have breaks in between. So, investing in children and their societies, our core mandate is a world in which all children grow up in safe and nurturing environments so that they can reach their full developmental potential. In the areas and the countries where we work, the problems that we seek to address include high rates of violence against women and violence against children. There is high economic stress and food insecurity. There is limited access to essential services and social support. And there are quite a number of negative or harmful social and gender norms that we try to tackle in the low resource settings where we work. To tackle these problems, we have quite a number of solutions, and today we will be sharing our solution around economic support and skillful parenting with a view of addressing violence against children. But beyond that, we have programs that seek to make learning environments safe for children, programs that are aimed at equipping children and young people with life skills, programs that are geared towards strengthening systems for child protection, for health, for early childhood care and development and education. We also have HIV/AIDS care and treatment programs, and all our experiences, then we use them to lobby and advocate for appropriate policies and practices at national and subnational level. Most of our work is targeted in low resource settings, rural and peri-urban areas in Kenya, Tanzania, Cote d'Ivoire, and we have recently expanded through partners in Zimbabwe and Uganda. And we also have a number of our partners in Asia, specifically Cambodia, who also implement the same approaches. We are a team of 21 professionals supported by a pool of community parasocial workers with whom we train and certify on our approaches to help us deliver this work. Our combination of solutions I've seen over the last 30 plus years reduce the risk factors associated with VAC, and all these have led to improved child and family well-being. So today, together with my colleagues, we'll be reflecting on these aspects on the agenda. Mr. Yao had done a good job of introducing ourselves. I'm the director of the organization based in Nairobi, Kenya. And for the last 17 years, we've been working together with the team to craft solutions that are geared towards creating safe and nurturing environments for children, with a specific focus on violence against children. Kudely is our country coordinator based in Tanzania. He has been doing child protection, community development, and family support programs in low resource settings in Africa. And he's here today also to co-present with me. And then we have Mr. Joseph Ogol. He's currently responsible for household economic strengthening work within ICS, guiding our economic strengthening intervention design and implementation. So the first session will be looking at the relationship or the nexus between poverty and violence against children. I know most of these aspects are not new to most of us, but we would be reflecting why this is important for us to know so that we can develop or implement economic interventions to address the risk factors associated with violence against children. So I know globally the violence against children problem is still grave. The magnitude and extent was highlighted in the recent Global Status Report on Preventing Violence Against Children 2020. I'm sure most of us have gone through this report that was developed by World Health Organization, UNICEF, and other partners. And it gives a grave picture of how the violence against children problem is still a significant one in all parts of the world. And by 2020, it was estimated that 1 out of 2 children aged between 2 and 17 years, that's about 1 billion children globally, experience some form of violence each year. We know that violence affects all children, but we know that there are specific categories of children who are even at high risk. And this includes children living with disabilities or HIV/AIDS, those suffering from extreme poverty, girls and boys in institutional care, children separated from their families or on the move. This could include migrants, refugees, or asylum seekers. Among these categories, they face the greatest risk. And we know the consequences of violence against children remain very grave, and the economic costs associated with these consequences are very high. There are several studies that have been done on this. In US, it is estimated that it costs around $228 billion a year to be able to address the effects of violence against children. Closer home here in South Africa, we see that the costs are around 13.5 billion in South Africa. So I would invite us, if we have not been able to review this report, if we go to the global platform to end violence against children or the World Health Organization platform, we should be able to access this report for further details. With that overview, I want to invite my colleague Kudely to take us through the next part of the presentation. He will be able to start over by sharing the global poverty situation and why then this is a risk factor for violence against children. So thank you everyone, looking forward to meaningful engagements, and welcome Kudely for the next session. Karibu.
Okay, thank you Beatrice for putting us all into perspective about the global trends on issues of violence against children. Ladies and gentlemen, we all agree and know that poverty is a very big issue in families, in communities, and in many various parts of the world. But living in extreme poverty is a more big issue and put families and the communities and children into various forms of risk. And when we say living in extreme poverty, we mean when a member of the household is not able to afford living in terms of expenditure that goes beyond $2 in a day, but also this rate goes higher when you go to the middle income countries and higher income countries. And if families and community members and members of the household are in the high level of extreme poverty, this experience is almost in many parts of the world, including Sub-Saharan Africa, Asia, and other parts of the world. So they all face different types of risk, and they experience a lot of dimensions, especially when it comes to the low-income countries. So it leads to make children and members of the families and the household find themselves living in inadequate or unsecured livelihoods. They find themselves in a situation where food is a very big issue, so they are food insecure. They also live in an environment where there is limited access to services and amenities, but also access to information becomes a challenge, and secure environment where the security of children and the other members of the family is not guaranteed. They also find themselves in a various number of strained social cohesion. And we can see billions of children are facing these kinds of multidimensional poverty. So they lack access to services. They find themselves into various forces. They find themselves being forced to survive in a very difficult environment in families which are not able to afford the cost of just giving them services. And from that last year and this year, the coming up of COVID-19 have increased a set of setback to the families, and therefore facing a number of risks and challenges, and the poverty rate is increasing. So the families are finding themselves in a very difficult situation to take care of the children. And all these kinds of environment, they have a very big relationship between the way families have the capacity to take care of the children, to make sure children are protected, children have access to their own rights. Next slide, please. So when we speak of the issues of poverty and its relationship to violence against children, we say when the families are in an environment or in a situation where they have a lot of poverty, poverty offers a fertile ground for violence against children because it enhances the risk of abuse and exploitation, but also it makes children to find themselves in families where there is a high level of vulnerability and therefore inadequate access to basic services, because poverty is the main underlying factors which is preventing millions of children to get services, and therefore leads to child death each year. It also causes tens of millions of children to find themselves in the situation where they experience hunger, they miss out of school, some of them will be able to drop, some of them can't be able to get registered, and we all know if you miss out the birth registration, so you are likely to miss some kinds of your own rights. And if this happens to the children, it puts them into a very big risk. But also, since families are not able to provide for them, the issues of health and nutrition and the other facilities, accessibility to their children also becomes a challenge. But families also, because of poverty, they experience a lot of socioeconomic pressures in the household, and this leads to work. Parents find themselves in a lot of stress, and sometimes they end up pushing their children to get married, especially girls, believing that at least if the girl gets married, they will be able to get dough, they will be able to get money, then they will be able to survive. And probably the girls will go to the husband, and the husband will be able to take care of her, something which is also not true, because they end up finding themselves into risk. Some children also find themselves entering into transaction or commercial sex, but also others are forced to work in, for example, in the mines or in the farms, at least to get money for the survival. We also know that poverty or the poor children or the children who are in a great risk or an environment which are not conducive puts them into a risk of protection violation, because they live in an insecure environment, which exposes them to several physical and sexual violence. For example, at community level, the physical violence among the young people is strongly associated with the issues of economic deprivation, because they find them in a very difficult situation, so they are forced probably to go out, live in streets, start working in streets, so for them to earn money, then for them to make sure they are able to survive and continue living. But also we say, and we all know, that poverty contributes to inadequate care of children in several ways. So the children from the poor families are at great risk of being left unsupervised, or they are poorly supervised by their parents and their caregivers. Some of them end up being taken to care institution, or they get forced to live in the streets. And all this increases a lot of risk of abuse to the children. And some of the children, because the parents are also struggling to find income or to get food for their children, they may end up leaving their homes for so long. For example, men, if they find themselves in a very hunger situation, so they decide to leave home, they go very far to look for food, to look for money. And so the children end up leaving themselves alone. No one is there to take care of them. So they get emotionally abused, and they end up facing themselves into several troubles because there is no one who can give them guidance on what they need to do or what they need to get supported. But also the parental and care stress due to poverty increase the risk of violence against children. And we say economically deprived caregivers or parents have shown to be less responsive in the issues of parenting due to the stress that is associated with the lack of income or the lack of money or the lack of food which they could use to make sure their children are well taken care of. So not only does poverty exacerbate violence, but also violence can also perpetuate poverty. For example, children who are subjected to abuse or neglect are more likely to underachieve at school, or they may end up dropping out of school, and then they live in the educational system. And at the end of the day, they are not able, if they are not able to continue with education, their dreams to be educated and later become very good citizens who could help the society is not being realized. But for example, children who drop out of their homes, they go in and they start working in the street, they end up living in a very neglected life. So even their development stages, the kind of health system they were supposed to undergo, they will not be able to attend. So they don't develop very well. Sometimes they adapt very bad behavior, and they end up being deprived either socially or economically as a result of poverty. So the cycle of poverty continue going. You can see if the family is very poor, they are not able to take care of their own children. Children may end up going into street, or they are not being educated. So they will end up being poor. As they grow, they get also children. The poverty cycle continues. Having seen the relationship between poverty and how it contributes to violence against children, we know the participants who are here have experience from their own countries. It could be better if we have we'll take some minutes, like 10 minutes for just the reflection. And we will want all of us to reflect the two questions listed here. One is, poverty does not cause violence against children. However, living in an extreme poverty is in itself a violation of rights. And it is enormously increases the vulnerability of children to violence. Do we participants agree with this, or how do we see what is the experience from our own countries where you come from? Are there also other examples or evidence of the relationship between violence against children and poverty in your own context? Or you completely say poverty has no any kind of contribution which leads to violence against children? So we would like to invite participant reflection and ideas on this. You are warmly welcome.
I think that the issue is very interesting, and I think that what I was going to say, I think that it's in the chat, not only to think about poverty that has to do with violence, but also think about poverty like a type of violence towards the child. In our region, 50–60% of the poor are kids, and this implies an inequality from one side, but on the other side, a concentration of the conditions of disadvantage, and of course that affects the development of our kids in this sector of the population. That's why, because of the impact that it has, the poverty has, the extreme poverty in the development of our kids, we search for opportunities to access the rights, and of course we can consider poverty in itself like a type of violence against childhood. So not for one specific person, but for someone that we can identify clearly, but not from our society, not from our social organization or economical organization, and not only something that is something of big responsibility for the state, but also all the actors that form part of this society. We're all responsible for this, of the level of concentration of the wealth and the majority. And so that's why I think that what we can consider poverty a situation of violence, unfortunately, and unfortunately we participate in this ourselves, unfortunately. Thank you.
Je dis merci encore pour cette présentation, et nous sommes heureuses de participer à ce webinaire. Pour moi, je voudrais dire que au niveau des violences à l'égard des enfants, la pauvreté est un facteur favorisant. Et au niveau des questions liées aux violences basées sur le genre, nous constatons que, à l'analyse des cas que nous recevions, que les enfants qui sont témoins des victimes des parents, qui sont aussi victimes, deviennent auteurs. Chez nous, ici, on dirait les enfants en conflit avec la loi. Mais en réalité, les parents sont les bourreaux de ces enfants-là, puisque les enfants vivant la situation de leurs parents sont détruits et ayant besoin plus d'affection paternelle et maternelle, ne le recevant pas, ces enfants cherchent de l'appui à l'extérieur. Et une fois détruits, puisque ces violents les détruisent psychologiquement, ces enfants-là vont en dehors de la famille. Nous avons eu des cas où des enfants ont été découverts et ramenés dans la cellule familiale. Ces enfants sont ressortis. Ça veut dire que le problème se trouve au sein de la famille. De sorte que ces enfants refusent même d'aller à leur propre domicile. Donc, il est important aujourd'hui d'attirer en dehors de la pauvreté l'attention des parents, parce qu'il y a beaucoup de parents aussi qui ont les moyens, mais qui ne prêtent pas assez d'attention à leurs propres enfants. Ce qui fait que ces enfants vont à la dérive. Et nous pouvons dire qu'il y a les VBG en lien avec la délinquance juvénile. Ces enfants, une fois dehors, qu'ils ont l'affection paternelle, maternelle de certaines personnes qui leur accordent de l'affection, une fois qu'il y a la confiance, ces personnes-là les utilisent à d'autres fins, à supposer des dealers. Toutefois qu'il y a la confiance, ceux-là les utilisent et peuvent même leur donner la drogue pour qu'ils puissent consommer, parce que nous voyons la délinquance des enfants, beaucoup d'enfants qui tombent qui prennent la drogue aujourd'hui, et ce fléau-là est en train de miner partout les enfants, la plus grande partie de ces enfants. Je voulais apporter cette contribution pour attirer l'attention de l'ensemble des participants pour dire qu'en dehors de la pauvreté, il y a un autre phénomène lié aux violences familiales, un lien avec la délinquance de ces enfants, et qu'il est important que des actions soient menées au sein de nos cellules familiales pour comprendre quel est le vécu de ces enfants.
To understand what is their life like. So and all that contribute to the condition to violence against children. So this is what I wanted to say, and obviously this concerns the Ivory Coast. Thank you.
So, dear participant, what we all agree. However, I was not able to hear the French and the Spanish, but reading from the chat box, I could be able to read some few words and then relate of what the participants are trying to present. What we all agree on the relationship between poverty and violence against children, these issues are interconnected. They have a very big relationship. They are related. And if we want to address violence against children, it is not possible to fight one without engaging the other side. So in our next sessions, my colleague Jose will be coming in after a break of few minutes. He'll be taking us from experience we have been learning as ICS to see the kinds of economic interventions and the pathways, if they are implemented in a combination or alone, what will be the results, and what kinds of economic intervention which will be able to fit a particular family. How do we select and decide that these particular kinds of economic intervention will be able to fit these particular kinds of families?
Okay, welcome back to the second session of this webinar. I'm sorry those who asked questions through the chat box were not able to be technically into account. You can keep your questions and make sure that the facilitators will respond to your questions during the question and answer session. Let me give back the floor to the presenters to continue their presentation. Thank you.
Thank you so much, and welcome back to all of us. I want to proceed with our next session. And from our previous session, we at least have a common understanding that Violence against children and poverty are interlinked, and it is therefore not possible to fight one without the other. Now, in our further discussion, we are going to look on how economic strengthening interventions, combined or standalone, improve violence against children outcomes. And we shall be looking at our next slide that presents our economic strengthening pathway. I want to mention from the onset that when you look at the pathway, it depicts some growth and decreasing vulnerability. It is a pathway towards growth and decreasing vulnerability. Households progress sequentially through several key outcome areas, and you can see the key outcome areas. We have areas where households are basically targeted with social protection services, and the pathways or the outcomes around that include recoveries of assets and generally household consumption being stabilized. Still around that area, we have families supported to build self-insurance mechanisms and protect key assets. The rate of progression of each household along the economic strengthening pathway heavily depends on a number of things. The entry points depends on the capacities. It also depends on the kind of orientation and the motivation that are provided to these households. Selected sets of economic strengthening interventions address typical priority needs associated with each category of households, leading to a realization of the 5 expected outcomes that you can see in our pathway. And again, I need to mention still that different players in the marketplace will always provide different economic strengthening interventions. Now that leads us to issues around targeting, how to target our beneficiaries. Again, I need to mention that our experience with the targeting has confirmed that poverty indicators heavily depend on local context. For instance, food insecurity seems to be a really solid indication of poverty in Kenya and Haiti. But when you move to Peru, the poorest are relatively food secure. And therefore, social and geographic isolation really counts. Still on that, lack of access to productive land could be a real poverty indicator in South Asia, but not in Ghana, where villagers can farm communal land. This brings, bringing in local knowledge heavily helps reach more agreeable and relevant understanding of what constitutes extreme poverty within a community. And therefore, our experience has been that communities are directly engaged in determining the criteria for extreme poverty. They first create some local maps where they identify households Then they conduct poverty, wealth ranking to discuss household characteristics and reach consensus on who the poorest are and who should be included in various programs. This employs a number of tools. A number of tools are put into use to categorize families into vulnerability levels. And now on the slide that is projected to you, we are able to see the parameters which households consider as they categorize households into the various vulnerability levels. And we have basically 3 vulnerability levels. We have highly vulnerable households, we have moderately vulnerable households, and we have least vulnerable households. The 9 parameters projected to you from food security, assets acquisition or asset ownership, sources of income, levels of confidence, self-confidence, household priority needs, the risk profiles of families or households, access to social networks, coping strategies, and resilience levels. These are parameters that households consider as they categorize families into various vulnerability levels. For instance, on food security, a least vulnerable household is considered okay, while a moderately vulnerable household with regards to food security are considered fair, while food security is severely inadequate in a highly vulnerable household. The same to a parameter on resilience, where a highly vulnerable household is considered to be very low in terms of resilience. A household that cannot withstand shock or in times of crisis finds it so difficult to rise on their feet, while a moderately vulnerable household looking at it on resilience is considered moderate. So this really helps in targeting and deciding on which economic strengthening interventions targets or are targeted towards which category of households we are working with. And now into the next slide, we are able to see samples of strategies or interventions that have worked or could be considered for various categories of households. Families that are highly vulnerable. If we look at the blue shading at the bottom, are considered to be in need of social protection services, to be targeted with social protection services. And the social protection services could include merry-go-rounds. I know majority of us could be conversant with merry-go-rounds. They are some form of informal savings and loans methodologies within communities. Then the court could also be considered with asset transfers, which could include cash transfers, productive assets, food for work, health insurance services. Some more interventions under the social protection services include kitchen gardening, promotion, rearing of small stock, including indigenous chicken, rabbits, goats, pigeons, and the rest. And last but not least, under that category of social protection services, we could target the highly vulnerable families with financial literacy, so that they are able to make informed decisions on deciding on the various kinds of financial services in the market. Moderately vulnerable households in the economic strengthening pathway are at the middle, and there we could consider them as a group that needs to be supported to grow their assets and protect whatever they have. That group, the moderately vulnerable households, could also be targeted with a range of interventions, including linkage to voluntary savings and loans methodologies, which is also called savings and internal lending communities or group savings and loans, GSL. They could also be targeted with agribusiness, integrated gardening. We have post-harvest management of their farm produce. They could also be targeted with rearing of a small stock, including chicken, rabbits, goats, bees, butterflies, as well as services around financial literacy. And finally, on the samples of interventions targeting the least vulnerable households, this is a category of household that are considered to be targeted with income growth, to be encouraged to grow their income. They are not at the same levels as compared to the least and highly vulnerable. And therefore, they could be targeted with more of skills training, issues around entrepreneurship and small business management, financial education, and linkage to markets. And when I say linkage to markets, I'm referring to linkage to things like farm inputs, information, a linkage to various produce, linkage to microfinance institutions where they can access credit facilities and other formal financial services, micro insurance services. This category of families could also be targeted with value addition and value chain development initiatives. Still, financial literacy could also come in handy for this category of beneficiaries. And as you can see, a service like financial literacy cuts across. It cuts across all the categories or vulnerability status, or across all the beneficiaries targeted. Our next slide now presents still on the pathways, but it's sharing with us some of the results that we realize when we engage in the interventions mentioned. For instance, agribusiness. I need to mention upfront that in our subsequent sessions, you will see agribusiness discussed more in details and how it really works out in the whole process. So with agribusiness as one of the economic strengthening interventions, some of the key results include increased knowledge on effective and efficiency agronomic practice, increased production of food crops. We have increased knowledge and skills development. And finally, we have reduced risk of girls and early marriage due to being forced by parents as a result of poverty. And we are reiterating that agribusiness alone could increase child labor if not checked. Then we have services around social protection. And in social protection, if you can remember, I mentioned services like the cash transfers and the cash in-kind incentives. A number of results or outcomes from social protection services include stabilized household consumption, retention of children within the family or households. We also have reduced risk of sexual abuse and exploitation among children and youth. Still, we will realize increased food security and increased knowledge and skills on money management. We have programs around that target youth and women, youth and women empowerment programs. We have the technical, vocational, and education training services. These, we have also seen that they equally contribute immensely, and some of the results, when well implemented, could be increased ability to meet basic needs, for example, access to sanitary pads by girls. We have results like reduced risk of early marriage and pregnancies, reduced risk of sexual abuse, especially engaging in commercial sex, and reduced dependencies to parents or caregivers. Services around savings and financial literacy have resulted to formation of support groups, access to cheap credit, families able to access cheap credit through engaging in the formal or informal savings and loans methodologies. We have seen savings culture also inculcated in individuals and generally improved livelihood. Finally, entrepreneurship training and support as an economic strengthening intervention has also resulted in improved business skills, increased ability to identify and utilize opportunities and resources, increased self-confidence, and therefore income-generating activity startups. The increase in basically that increase in self-confidence and then increased income-generating startup to generate income. Even before we move to the next slide, I would also wish to mention that social protection as one of the services or one of the services first in economic strengthening contributes to reduction of risk factors and generally strengthening protective factors related to child protection issues, including violence, risky sexual behaviors, child marriage, and child labor, especially when combined with links to other services. And specifically, a few examples on cash incentives and in-kind incentives. A review of vigorous evaluations of cash transfers have indicated that cash transfers can address several different sectoral outcomes with relevance to child protection, including reducing monetary poverty, increasing women's empowerment, and improving school enrollment and attendance. Of course, those are among other key outcomes. Evidence I've also suggested that this can be enhanced when provided with links to other services and efforts to address unequal gender norms and power dynamics. A good example has been the Zomba cash transfer program in Malawi that provided incentives in the form of school fees and cash transfers to secondary school girl pupils and recent dropouts to stay in or return to school. The program offered approximately $10 per month, conditional on school attendance, on at least 80% of the days the girls' schools was in session. After a year of operation, beneficiaries were 3 to 4 times more likely than the control group to be in school, and the dropout rate was 35% lower among participants than among the control group. I think we can follow up on that and see more details. And now I want to get us into our reflection moment. Could we think of other examples of economic interventions that are implemented to address risk factors associated with violence against children? This we can do and continue posting our responses in the chat box. And of course, if there are questions, we could have the opportunity to ask and respond to them.
All right, so I can just, I would like to, just to be rather short, so just because you spoke at length. So you spoke about the link between poverty and violence, and this theme is extremely important because we work with people who live in very dire situations. They live in extreme poverty. So you have explained very well what are their living conditions. That is why we have to tackle different aspects, such as education and many other aspects that could improve their living conditions. I think that it is very important also to consider another element, that is populations and communities must be accompanied, must be followed. And there is a major question, that is how can we just make it possible for these people to live in according to their dignity, not to lose their human dignity, even though they are living in extreme poverty. So you just strengthen and underline the fact that the very vulnerable families just lose their dignity. So we have to make it possible for these people that are also living in extreme poverty to live in good conditions, so that children are not left alone, so that children are not abandoned in the streets. So our reflections must also be focused on how we can accompany and be with these people living in extreme poverty. For poverty is a very unjust situation. Poverty entails violence. So we must just try to reverse this situation. We must provide these families with appropriate support. we must not only help them to have access to goods and all those things that have been said, but there is also another kind of work we have to do together. That is, we have to build up a social system that might support these people so that these families remain united, so that children are not abandoned. And it is only when we protect families, also in extreme conditions, that we can prevent violence, that we can prevent these children from living in the streets. So violence is to be avoided, and when there are no services, there is no support to these families, well, there is a form of violence. When the society is absent, this absence is a form of violence. And well, I also have examples showing that sometimes even the police is violent, because I have an example of a lady who had stolen something and then she had been abused by the police. So there is also something to be done with the public authority. So what is the role of public authorities in that context? So there is another case of a young boy living in the streets, and so he was asking for food, but then not receiving the food, the boy died. And obviously that means that there is an absence from the public institutions, because these things should be avoided. So sometimes parents are not responsible for the situation they are in, they live in. So this is, the question is rather complex. So there are different forms of violence. Absence is a violence. And when obviously parents just live in extreme poverty, sometimes they become violent, and their violence is then, let's say, it affects the children. So they become the victims of their parents' violence. So there are all these aspects. But I'm convinced on the basis of my experience that it is not only poverty in itself that just entails violence, but it is also the stress, the pressure that is exerted on the families that triggers the violence, because so the same situation can give way to different reactions. That is, sometimes the families do not react in a violent way to poverty, but other families do. So there is the social context, the social society that should act in a way or the other. So I was saying that there is something to be done, something very important when we want to build up a social system that is valid to help these families. This is a system that can just limit the stress caused by poverty. So thanks a lot. I think that we also have to work on, let's say, more down-to-earth measures. That is, we have to say that authorities too have a role to play. That is, obviously, it is not only the ONGs or other organizations that must be involved in that, but the authorities, public authorities have a role to play. We have to involve the authorities in this process. So the state must do something. So the state has got its responsibilities. So the state and the authorities should start and implement specific programs in order to limit violence and poverty. So we have also to act with the public authorities. We have something, so sort of lobbying to do with the public authorities so that they can just become responsible, also to be involved in our actions against poverty and violence. So the authorities must accompany, must be with these families, with these very poor communities. There are laws, there are policies, there are national programs that have to be implemented. And obviously they have a role to play in the social development of these families. And we have also to work with people, because these people should claim their rights. So we have to teach them how they can claim their rights. That is, sometimes they don't know that they have rights. So, but we have to make them understand that they can ask. They can just address themselves to the public authorities. Thank you.
Thank you, Musa. We have a contribution in the chat box from Antonella Rojas Rivera. She said that Juntos is a social program in Peru. It's a conditional cash transfer to women in extreme poverty. The main purpose of the program is to ensure the attendance of children at school and healthcare system. So as long as finance guarantees those terms, the state contributes the cash transfer. I know the program is recognized for its great result. However, it's not necessary to consider the hours women spend in care activities and the impact of that in the personal growth. This is the contribution from Antonella from Peru.
Thank you so much. We have listened to the reflections, and they are so impressive. We have seen examples from Argentina. We have seen examples from Peru. We have seen the sentiments around budget increase towards the interventions meant to address violence against children. And there was also a reiteration that how do we should let the people live with dignity, the need to let people live with dignity. And I believe that is one of the expected outcomes when we implement these interventions. Yes, I also agree that poverty is a very unjust situation. Then there was this other concern on the role of public authority. And here, public authority, I believe, refers to include even our governments. And I would mention that a number of governments have supported social protection services or have implemented social protection programs, either by setting up policies and programs that are aimed at preventing or protecting people against poverty or just vulnerability and the social exclusion throughout their life course. Of course, with a particular emphasis towards vulnerable groups. Then finally, I've also heard about the need to take the rights-based approach, which I personally totally agree with. Maybe if my colleagues have something to add, this is the chance.
Yes, I agree that the dignity of the people has to be at the center of the interventions. And when we talk of the rights of the people, the rights of the children, the focus is to make sure these children are able to grow in an environment where their dignity is protected, their own potential they have is nurtured, and they are able to grow to become very good citizens who can be productive to the country and also to the community. So whatever we want to deliver, we need to make sure these kinds of principle is there. It's one of the value which is integrated into the program and what we want to deliver and aim to achieve. However, priority to the people who are in the extreme poverty is very key. And the way my colleague Jose had narrated to us, doing an assessment which will be able to tell us exactly what kind of family is in need of what kind of support, the kinds of vulnerabilities they are will be very key, so that when we want to deliver intervention and the programs, we are in position to say, I think these particular kinds of family, for us to support their protection of their own dignity and their own rights, we have to deliver this as it is their own priority, rather than just having something which we can feel it's universal, it will fit each particular family and children. Yeah, thank you. Beatrice, you can go.
Kudely, thank you, Kudely, for those reflections. Thank you, Joseph, for taking us through that session. Much appreciated for the reflections we have received from all the participants. I know we might not have a chance to respond to all, but we do agree with your reflections. Poverty is a very complex, multidimensional matter that requires a mix of interventions that are targeted at different categories of families based on their vulnerability. I know because of its complexity, a number of players need to come on board so that we can complement these interventions and support families across the economic pathway. There are quite a number of economic interventions that have been implemented across the globe with very good results, some of them of which Joseph has already shared. And we are glad even at the moment that within the INSPIRE package developed by the Global Partnership to End Violence, economic interventions are considered as one of the priority investment areas. And therefore, even in the funding environment for violence against children, economic interventions are currently being considered very key. And I know governments, as has already been mentioned, have invested a lot in working with the most vulnerable within our communities. The increased and gradual investments on social protection schemes, specifically looking at cash transfers for orphans and vulnerable groups, for the youth, for grandparents taking care of children, the elderly, people living with different forms of impairment. These are increasing in budgets by national and subnational governments. And we need to continuously lobby, as has been mentioned, to ensure that governments continuously prioritize this in the budget allocations every other particular year, even as the private sector and NGO complement with different kinds of interventions. But I think the key message that we are getting is that the targeting for economic interventions work most appropriate when families are characterized based on their vulnerability, so that economic interventions can be well targeted and more cost effective. Allow me to now go to the next session of our presentation. I will take us through our ICS approach in terms of how we address violence. Earlier on, Joseph had mentioned that economic interventions can be implemented as standalone or in combination with other complementary strategies. So while we have a number of economic interventions that we implement across different African countries, we also have a very specific approach where we aim at combining economic interventions with parent support programs in order to promote positive parenting practices, positive family relationships, so that we can be able to prevent violence and promote the development of children. This approach, we developed it all the way in 2014. Initially, we had been implementing parenting programs with the view of preventing violence against children. But we all know that poverty is a risk factor and is also a driver of violence against children. So increasingly, in our low resource settings, it became a core aspect of work to be able to invest in a number of economic support activities. In the areas where we work, we have smallholder farmers who are working on the maize value chain. They're working on the sunflower value chain, and therefore we decided to anchor our economic support interventions on improving their agribusiness practices. So what I have projected on the screen is our theory of change with regards to addressing the complexity that comes with the risk factors associated with VAC, of which poverty remains one of them. So we, in the different aspects of work, we combine our parenting support initiatives together with agribusiness to be able to address the multiple risk factors of violence against children. And this includes issues to do with limited knowledge and skills on positive and age-appropriate parenting and discipline. Another risk factors are the negative social norms that promote violence against women and children. There are also a number of families in low resource settings that have limited access and enrollment to basic services. And this could include health services, early childhood care and development, child protection services, birth registration services, nutrition services, and many other services that families who experience different forms of poverty experience. There's also a lot of parental stress and poor parental mental health within the communities where we work. And one of the members had reflected on this, that sometimes it's not the fault of the parents, it's because of the stress that they go through that could lead them to expose their children to violence. In these communities, there is also a lot of economic stress, food insecurity, and limited access to formal institutions where families can be able to access credit and other financial services. And then there's the inability of farming families, because now we are talking around the agribusiness support, to be able to translate that income to improved family and child well-being. We have seen a lot in our communities where, whether there is increased income due to cash transfers or modern agronomic practices, you know, when the man gets the money, then they run to the city, spend a lot of the money there. When it's over, they come back to the village and there is nothing left for the family. So the inability of farming families to translate this income to improve their well-being status is quite a big concern for most economic interventions, because the key parameters where economic interventions are implemented, they look at issues of asset increase, they look at income increase, they look at productivity increase, with less focus on how increased income and household assets can be translated to improve well-being at family level, can be translated to ensure that families are able to access the basic services that they require. So with all these risk factors, we combine both the parent and caregiver support program together with agribusiness initiatives to be able to address these multiple causes of violence against children. From experience, and over the last 6 or 7 years, we have seen quite a number of outcomes come from this combination. And there are short-term outcomes and there are intermediate outcomes. The short-term outcomes that we already see immediately when we implement this intervention is that parents and caregivers become aware and positive about their role. They improve their knowledge and skills on child development and stimulation, and that means their expectations of children are reasoned. The child protection risks are also reduced significantly based on the knowledge they are able to acquire. The prevention of abuse has also been experienced almost immediately. This combination of intervention is delivered. And there is stress reduction. Another key outcome that we saw, especially when you combine skillful parenting and agribusiness initiative, is the increased role and involvement of men in caregiving and parenting in the household. We know from contexts in Asia and Africa that, you know, when you talk about a parent support program, you're most likely to see many women coming to these sessions because the burden of care is left to women in most communities due to the norms and cultural values that exist in different communities. But when you combine the parenting intervention together with agribusiness, then all of a sudden there is increased involvement of men. Most men participate in economic support programs. When you put them in combination with parenting programs, we have seen a significant increase in countries where we work like Cote d'Ivoire. Most of our parenting initiatives are 90% male involved. And this is quite significant given that in the fight, in the promotion of family strengthening, the role of men has regained a lot of attention in the last few months. And there are quite a number of strategies that have come about with regards to how do we then involve and motivate men to participate in VAC initiatives. And we have found that this is one key aspect that has worked when you combine these two interventions. Of course, other outcomes we continue to see include improved relationships at household level. And that means that family conflicts and tensions are reduced significantly. We have seen that parents and children become part of the social network. Remember when Kudely was making the presentation, one of the dimensions of poverty was social isolation and stress. People who are extremely poor tend to be isolated in their communities. They're rarely reached with even extended family support. But when you make this combination, we have seen this increase substantially across the divide. Then the last aspect of short-term outcomes, we also see an increase in the yield or the production of farmers, which then translates to increased food security and income, but also financial budgeting and savings increase in those families. All these short-term outcomes in combination have reduced significantly stress and depression in parents, thereby addressing the stress factor as a risk factor to violence against children. It has improved relationships, not only between the partners in the household, but also between parents and their children. It has significantly reduced violence against children, including child maltreatment, and I'll be sharing this in a later slide. And it has improved the ability of families to be able to access different services at household level. Ultimately, all this has led to improved situation of household where violence against children has been reduced. Now, the parenting support model is not only a training that we provide to parents through a group approach, a peer group approach, but it is also delivered in combination with community awareness raising events where parents and caregivers are taken through a number of modules to reflect on their parenting role, to reflect on the risk factors associated with VAC, to build on the strengths they have at family level so that they can, you know, strengthen the safety nets, strengthen the social support that they have, and the other protective factors that are associated with violence against children. We implement the parenting model in parallel to the economic strengthening model. They're implemented at the same time, most of the time in all the communities where we are. So the entry point becomes the agribusiness initiative, where farming families are grouped in parent peer groups. They benefit from both agronomic training, but they also benefit from care and caregiving support. This program is targeted to parents and caregivers with children from age 0 to 18 years. For the last 6 years, it's been delivered through local facilitators that are recruited from community-based organizations, from community groups. But over the last 2 years, we have scaled this approach through government structures, so government health workers, government social development workers, government community workers have been trained on this approach so that they can be able to reach more families within our communities. The parenting model has 10 modules that looks at both parent well-being outcomes and child development outcomes. So it's a combination of helping parents to deal with their own mental well-being and health, to deal with the stresses they experience, to deal with the conflicts and the violence they experience at household level. When that is addressed, then we begin to address and strengthen the factors and the knowledge and the practices they have on caregiving, looking at the different age-appropriate development stages, age-appropriate discipline strategies, how to build self-esteem and mental well-being of our children, etc. The parenting program is also linked to quite a number of interventions that we do within the school to address violence against children, so that parents can be able to work in partnership together with the teachers to reinforce what is taught both at home and in school. So for the economic intervention that we do on agribusiness, it has several components. Farming families are grouped into cooperatives. They're able to access agronomic training based on the different commodities that they farm. They are given farm inputs on credit. They are trained on post-harvest handling, and then they are linked to markets where they can be able to sell their produce, and then they are supported through family budgeting to be able to translate their income to improved well-being at household level. This agribusiness support implemented both in Kenya and Tanzania, we have seen an increase in yield by 79%. And overall, for the families that we targeted, which are mostly vulnerable, most vulnerable and moderately vulnerable, we've seen an increased income by 25% in those communities. So these are the different levels of interventions that we were able to undertake in Tanzania, for example, in terms of improving skills of the farmers on agronomic practices, which then it leads to increased productivity. Based on that, farming families are then trained on post-harvest handling to avoid wastages in the produce that they have. So part of their produce they keep for food, but another part they are able to sell and then generate income that they can be able to use to pay for other basic amenities and services relating to education, health, child protection, etc. We have done quite a number of studies on the combination of skillful parenting and economic intervention, but we have also tested economic interventions alone with a view of seeing how the combination and the standalone approaches are able to address the risk factors associated with violence. We've done around 5 studies. The first study was in 2014-2015. We collaborated with the University of Utrecht from the Netherlands to test the impact, the cultural feasibility, and the acceptability of this combination of programs within the community. The second study that we did was a randomized controlled trial that we collaborated with the University of Oxford, the University of Glasgow, and the Tanzania Medical Research Institute to be able to test the combination of skillful parenting and agribusiness and how that addresses violence against children. We were able to test the efficiency and effectiveness of the parenting intervention alone. And we were able to test also the effects of the economic intervention alone. We have also done 2 impact evaluation studies conducted by Innovation Poverty Action across the years 2017 to 2019 to test the impact of this combination in reducing aspects of violence against children. And in Cote d'Ivoire, the focus was how this combination then addresses issues of child labor within the cocoa supply chain. And other evaluations that we've been able to conduct. So together, these evaluations bring to us key evidence, but the key aspects are already shared on the screen, but we are saying that a sustainable increase in income, together with greater knowledge and improved parenting skills, significantly change how families function, especially families in low resource setting. We've seen that higher incomes reduce the stress of poverty and its effects on parenting and caregiving. We've seen that better parenting skills are able to make families more efficient, and they're able to improve relationships, and age-appropriate parenting is strengthened. We've seen families staying together so that issues of conflicts and tensions are addressed. And ultimately, all these have led to a favorable effect on children. Specifically, we are talking about the combination of both parenting and economic interventions significantly reduces child maltreatment alone. But in any case, parenting, when also delivered by itself, can reduce significantly violence against children, but the effects are much better when there is a combination of both parenting and economic interventions. We have seen an increase in income, an increase in household assets and food security. We have seen a shift in attitudes and beliefs around parenting, and the ability of families now with their increased knowledge to be able to demand for basic services and be able to access the same. If they are free, then well and good, but in certain instances in our communities, most of these services and amenities are paid for. There is a small fee that is always subsidized by government. So through increased income, then they're able to access some of these services. We have seen improved relationships between the parents and the children. And we have seen the ability of families to be able to improve their planning based on the family resources they have. And all these then, all these investments have then led to the reduction of violence against children and improved the well-being of families. Now, the combination has better and much more impacts. And I know from the presentation of Joseph, there was an emphasis on the fact that economic interventions alone, as we saw in the randomized control trial, can increase the risk of children being violated in many forms, child labor just being one of them, but also the fact that parents can be away from home, working in their farms, and therefore leaving their children unsupervised, but also children accompanying their parents to the field to contribute and support their parents. So economic interventions alone can address certain risk factors, but they need to be checked to ensure that they don't increase the likelihood of other aspects or forms of violence taking place in those particular families. Now, based on all the internal evaluations and the external evaluations that we have conducted over the years, we, from experience, then advocate for combinations where they are necessary. We have just seen that the vulnerability of families is varied based on their risk profile, based on their vulnerability category, and therefore poverty being a complex issue, being both a driver and a risk factor of violence, a mix of complementary interventions are required. One intervention alone might not be able to address the many risk factors associated with violence against children. So from the evaluations, we see primary outcomes, and we also see secondary outcomes. And for us, the primary outcomes we've already mentioned in the previous slide. They are summarized here. Key with regards to this are the associations that Kudely had presented in the beginning. How then does poverty contribute or become a risk factor of violence? And therefore, how does this combination address those multiple risk factors? So if we're able to increase the ability of families to increase income, to increase household assets, to be able to translate the same to improved well-being outcomes of not only the children, but the entire family, then the protective factors are strengthened at family level. And therefore, the risks associated with violence are significantly reduced. And with that, then we see a significant reduction of violence. And we see a number of issues also coming up that can help us lobby with the public authorities to be able to combine this intervention based on the resources that are available within our different settings. The evidence that we've been able to generate over the last couple of years have enabled us significantly.
Por los últimos años.
Thank you. We are just finishing. So a number of lessons we pick from our experiences of implementing economic interventions alone, but also combining them with other social development work and care, such as parenting. So we see that while skillful parenting and agribusiness trainings in combination are effective in terms of reducing violence against children or the risk factors associated with violence against children, parenting programs alone, when implemented alone, are also effective. But the combination actually gives us better results. From the randomized control trial, I've already mentioned that the risk factors of violence increase if not checked when economic interventions are implemented by themselves. But this combination has also enabled us to have an unusually high participation of rates of men in our programs, which has been over the longest time a dilemma in violence against children prevention initiatives. So this has improved significantly in the countries where we work. We've also seen from the presentation of Joseph that family vulnerability assessments are quite critical so that we have targeted economic interventions that speak to the various vulnerability needs of families. So we cannot go to a community and have a blanket economic intervention. We might win in some areas, but we might lose in some areas if we have the wrong economic interventions targeted within the wrong group. The combination is also important because there are quite a number of risk factors that lead to violence against children. So if you only do one intervention, then you're not able to address multiple risk factors. So we advocate for the combination where necessary, but where not necessary, let us check to ensure that our economic interventions are not then increasing the risk of children being exposed to further violence. So I'd like.
Well, I want to say congratulations for the presentation today. Well, the actual crisis is that really has really grown, you know, the difficulties of this family, because I connect with this presentation because here in Colombia and with, you know, with the program that we have here, we are formulating a proposal so that the young and the teenagers, you know, participate with their families to an integral formation plan. So even if we are in different continents, we are connected, we are on the same path and answering to the needs that the families have right now, and especially because, you know, the situation that they're in right now, the unemployment being so bad right now, because the situation right now is more than the poverty, is really, you know, the tools for this family that they don't have because they you know, they're under a lot of stress, because, you know, some things that are going out that are going out right now, because so we're trying to provide them with these tools, you know, and also with some formation, so to see if they can, you know, have some more favorable situation. So it's very similar to the process that you are developing there in your countries, and we hope that the family are able to actually build some alternative situation to go through this crisis that they're going right now, because there's no employment. So we're trying to help them along the path so they can get some, you know, other results. So I just wanted to share our experience from Colombia, and I just wanted again to congratulate you here from Colombia. Thank you so much.
Nous avons donc, so you spoke about agribusiness. So this group of agribusiness has been based on cooperatives, and banks maybe gave credit to these cooperatives. So that is my main concern. That is, what was the involvement of banks in the creation of these funds? And then Beatrice just spoke about these two levels, that is skillful parenting and also the economic scheme. And also she spoke about how to measure the outcomes of our programs, of our actions. This is how we can measure a bit the effects of our measures, of our actions. So it was a question a bit, but also a comment.
Thank you, much appreciated for your reflections. Diana from Colombia, I'm happy to hear that there are a number of interventions that you're implementing based on your realities, which are more or less similar than what we experience in Africa as well. So I'm happy to hear, and we are happy to share more notes on how we can learn together, how we can deepen the impact of our combination of approaches. But it's always encouraging if there is a community of practice where practitioners who are dealing with similar realities, are trying a number of interventions, can come together from time to time, reflect on this, learn from each other, pick best practices, and unlearn certain things that are not working well in some of these contexts. So thank you for your input and your reflections. And I do agree that the COVID situation has worsened everything. It has taken us several years back, and therefore governments and different players are trying to put in place a number of interventions to first immediately cushion families from the immediate impacts of the COVID-19, but also see how in the long term, then we can have very good and graduated economic interventions that can lift and address the immediate concerns, but also along the economic strengthening pathway, see how we grow families out of poverty. So thank you for your input. Amy from DRC, yes, credit facilities from microfinance institutions when you're working with farmer cooperatives is a big challenge and dilemma in most low resource settings, especially because of perhaps the risk profile of the different communities that we work with, and therefore banks or microfinance institutions might not be willing to work with this category of vulnerable families. And therefore, that's why the other complementary interventions become key to support families to be able to budget for their financial resources, to increase their literacy skills, to know how they can translate the income that they receive to increase their investments in their farms, but also to address the immediate needs of the family. So when NGOs partner with these microfinance institutions to allay some of their fears, then they have been open to trying out several business models that are suitable for this category of vulnerable families. So we see increasingly the banks and the microfinance institutions develop products that are targeted at different categories and testing those products across the divide to see which ones are working well for which categories of families. And when there is an additional care package that supports these families to translate this income to better use, then their risk profile improves significantly for them to be able to access these microfinance services. And therefore, that is why for us, in most instances, we seek to combine economic interventions with other care interventions that address the risk factors at household level. So thank you for your input and reflections, Amy, and glad to share more of our interventions through other platforms as well. But the combination is really important, especially because economic interventions in terms of measurements, globally, the focus has been on improved productivity, increased income, increased household assets, but then what next? Do they go a step further to assess what this improved situation of households is assisting in? So it's quite important that we ask ourselves, beyond income, beyond assets, then what next? How can we support families to be able to translate this in ways that could improve their situations over the longer term?
The way Beatrice said, you know, when you deliver the economic intervention to address violence against children or against women, the ultimate goal is not about, you cannot say I have achieved as soon as you have seen there is increased income or there is increased food at the household. The ultimate goal is how the increased food and the income trickles down into prioritizing the needs of the children, making sure the children are well protected, they are able to be taken to school, they're able to access health services, and they're able to grow in a conducive environment. And that's why for us, from experience, it has been very key that the combination is bringing a very significant results, because when these groups or these parents or the household are learning on how to improve their own economy, on the other side, they are also supported to learn and change their behavior in terms of how are they going to spend the income and the resources for the betterment of their own families and betterment of the children. But if you don't do so, for example, we had some evidence from the community. If you are not able to build their own capacity for them to change their behavior, for example, men, they may end up getting money, getting resources. Unfortunately, they will go to marry the second wife. So they increase the burden to the family instead of just improving the living condition of the family. So that's why we say it's very important when these interventions are integrated and implemented, they will be able to have a very good trickle-down effect to the lives of the children and the families.
I think one of the other added aspects that we have seen through this combination is the improved decision-making power for women in the household. Because then with increased income, we can also see increased conflicts if there's no extra provided in terms of addressing the tensions in the household. In smallholder farming communities, we have seen that it's many women working on their farms, but men pocket the money. And this has really disenfranchised many women. There's been a lot of demotivation. There's been a lot of tension. So when you combine topics of parenting that are related to improving communication, dealing with conflicts, safely talking about money, family budgeting, then we begin to see a household environment where couples safely talk about money, couples have opened communication channels, couples can plan together, and this has significantly increased the decision-making power of women, and to a certain extent for children as well to participate in some of these processes. So that has been very significant for us as well. Because for the economic interventions, there's been a complaint from women that they're the ones who care and work on the farms, but when the money comes, the man picks the money, they disappear in the city, bring a second and a third wife, so they do not benefit from this intervention. So we have seen through this combination, these issues being addressed as well. And even when women get money from their village savings and loan schemes, then they're able to safely negotiate and talk to their men about how this money can be translated for household economic improvements.
Sí, buenos días.
Yes, hello, good morning here in Peru. Good morning from Peru. Yes, yes. I think that Beatrice just commented on the situation of the woman in this project, and I really included that comment that why it's so important to also you know, talk about the gender equality, because here in Peru we know a lot of experiences of projects that have been very productive, that have been financed, and they were not beneficial for women or kids. So this is something that you have to really keep in mind, and you have to develop this. It has to be developed, you know, in parallel. You cannot do this before and this later. But you know, just the way you're doing this very articulate strategies that you're developing, you have to, you need a you know, you need, you know, a view, a very integral view on what you're doing. And I think that what you're doing is very interesting. And I thank you very much.
I want to take this opportunity to thank all the participants who managed to join in. It has been a very wonderful session and a very wonderful moment interacting with all of you, and we look forward to engage even more and more. Thank you so much.
For me, I always say every opportunity is a platform for learning. And I'm very happy to connect and talk to you participants from all the way from Peru, from Colombia, and other parts of the world. We are all working towards making sure our children are able to grow in an environment where they get supported, where they are safe, and they are able to grow and become a good citizens of tomorrow. As we perish, they will be able to come and cover the position we have and make the world a better place to live. So as ICS, we are open for learning from various parts, what you are doing, but also we are open to share what we are also doing. So thank you for being with us, but also thank you, Bise, for giving us this opportunity to share our experience. We look forward to hear more from you. Thank you.
So thank you, Maria, on the gender-based issues. Indeed, it's quite important for us to be able to address the gender-related aspects in our combined programming. What we see a lot is that there are shared risk factors for violence against women and for violence against children in our context. So our intervention, the Skillful Parenting piece, seeks to work at the intersections of violence against women, violence against children, and addressing these risk factors in all manners and in all ways. We also seek to do quite a number of gender analyses, at the beginning of each of these interventions, to see the barriers, to see the strengths that exist within our communities, and to see how then together with communities we can co-create solutions to challenge some of the negative and harmful gender and cultural norms. So social norms programming becomes quite key, and looking at these programs from that perspective really would address the gender issues that have been common that affect not only women, but also men. There are complaints increasingly also for men, being denied opportunity to participate in quite a number of programs because the women empowerment, dialogue has gained a lot of traction in this part of the world. So doing an elaborate gender analysis at the beginning of these programs and employing the appropriate strategies to address and challenge the existing norms become quite important. So with that, I want to thank all of us. I know the time was short. The reflections in the chat box were quite encouraging, were quite motivating. There are a number of us who are doing quite good work in our different contexts. I know BISE has a platform where members continuously share on best practices and lessons. We are not yet members, but we will be able to register. I'm sure we meet most of the eligibility criteria so that we can continuously share together, but feel free to contact us for more information, for us to share together on these aspects that we have talked on today. Thank you, BISE, for this opportunity to share our experiences. Looking forward to engaging further in the subsequent webinars, but also on other opportunities that may exist. Diana, Yao, and team, thank you very much. Thank you for participants for staying on and for sharing your experiences. Thank you, and over to Yao.
Thank you so much. Thank you for your excellent presentation. Thank you, Joseph Ogol. Thank you, Kudely. Thank you, of course, Beatrice, for your excellent presentation. I think we all noted that it's very important to have a holistic approach while providing support to the families and to make sure that we get rid of we put an end to violence against communities in the country. So thank you so much. Thank you all. Have a good afternoon, good night, and yeah, thank you so much.